Speaking at the launch of the national polio vaccination campaign, the minister warned that anti-vaxxer criticisms pose a serious public health risk, particularly to children, and should not be allowed to undermine disease prevention efforts. Luvindao added that polio, like many other waterborne diseases, spreads rapidly in areas with poor sanitation and urged households to maintain strict hygiene practices as part of disease prevention.
Unfortunately, the public health landscape has changed, and the anti-vaxxers and the conversations we are now hearing have moved away from just newer vaccines, even targeting the vaccines I'm sure a majority of us standing here today have received, including measles vaccination, polio vaccination. And this is very dangerous, and it is a dangerous conversation. It is dangerous territory because we then put our children at risk, and this cannot be permitted.
In the Zambezi region, the campaign was launched at the Ngweze Primary School. At the event, the Ministry of Health Control Public Relations Officer Walter Skamaya indicated that children do not need to present health passports to receive the vaccine. In addition, the ministry will also make logistical arrangements to reach children in flood-affected areas to ensure full coverage.
To put it on record that kids will not require the health passports for them to be vaccinated. However, they can still have those health passports, but no child will be turned away because such child did not bring a health passport. Children under the age of 10 years, they can still be vaccinated without health passports. And then in this particular vaccination campaign, we do not require a consent form for a child to be vaccinated.
Luvindao said the vaccination targets all children under the age of 10 as they are the most vulnerable to infection and transmission of polio type 2. She stressed that while children have already been vaccinated against types 1 and 3, it is essential that all children receive this vaccine to protect against type 2.